Hello, my name is Curtis Waugaman, and today I'd like to be talking to you about why the New York State mandate for mask wearing was ineffective in spreading the disease, COVID-19. Picture yourself going to Walmart. The lines are crowded, kids are crying that they can't have their favorite toy, their favorite piece of candy. You look over off in the distance and you see a lady holding up a shirt to herself to see if it fits. It does. It looks good. But she just can't justify spending the money today. So what does she do? She puts the shirt back. She's not alone in this. Several others are doing the same window shopping methods and putting it back. As you look around, you see people with masks over their chins, over their mouths, still breathing with their nose. Some take their masks off to sip water, to have a bite to eat. They take their masks off when they sit down because they're tired. These masks can consist of bandanas, t-shirts, fabric embroidery, plastic bags, plastic cartons, face shields. I've seen it all. This real-world scenario, there are thousands of opportunities for contact transmission. The reusing of masks, the lackluster of touching everything without gloves, and then reusing the mask and putting them back on your face is not effective in spreading and stopping the spread of COVID. In New York State, there's several inconsistencies with this mandate. They say, if you social distance, you don't need to wear a mask. But if you have a mask on, you have to social distance. Well, if you're sitting or drinking or eating, you don't need to wear a mask. But if you go outside and you have a barbecue and you're with friends, you must have a mask. And my favorite one, a cloth mask with strings that go around your ear, that's okay. However, a t-shirt over your face, a bandana, something like that, that's not okay. The purpose of this message is not to deny the fact that COVID exists. It's obviously a very real disease. However, it is to prove to you that the mandate for mask wearing was ineffective in spreading the disease in New York State. So whether it was a homemade mask, having the position of your body determine the necessity of wearing a mask, going so far as to talk about inflated numbers of cases, or simply the reusing of masks, the mandate was never a necessary option. I'd like to talk to you now about homemade masks. If you look at any virologist that works with contaminations or diseases, they're in level 4 mop gear. They have the gloves, they have the hood, the face mask, the plastic shield around them. They have oxygen being pumped in. They wear protective boots. Everything is sealed up. When they're done in the room that's contaminated, they leave and they go into another room for decontamination. They don't take these clothes back home with them. They don't go in the car with them. They hang them up and they go off for desanitization. Now, that's with any disease, right? With COVID, what New York Staters have been doing is taking a mask off of their counter where their keys are so they don't forget their mask, putting it on their face, walking around these contaminated stores, these contaminated restaurants, all of the areas, wearing the mask half on, half off, taking it on, putting it back on, and then bringing it back home into their house and setting it down on the kitchen table, on the dining room table, on the end tables, anywhere. Now they're bringing that contamination back into their house. Masks are also porous. I'm not going to do it here, but if you breathe smoke through your cloth mask, smoke will come through. Smells are able to be sensed through them. And if you can do that, then you can contact transmission through other instances. They went so far to say in New York that you needed to wear a mask only if you were standing in a restaurant. So now, let's say you're walking into your favorite restaurant and you see some sort of normalcy. You see people sitting down without masks, eating, talking. You see someone on their first date staring at their phone, texting other people. You see families together sharing food. However, you also see someone standing up, putting a mask on, walking to the bathroom, walking back to their seat, taking the mask off, and sitting back down. You see servers with their masks on all times. The inconsistencies are drastic in New York State. When it comes to the hospitals, New York State is given $15,000 for every COVID positive case within hospitals. Myself, I have family members that are nurses, that are doctors, that are physician's assistants. And they stated to me that if they came in with a fever, it was COVID. If they came in with a cough, it was COVID, specifically so that the hospital could get more money. Now, again, I'm not denying the fact that people do go to the hospital for this disease, and it's very real, and people have passed away solely because of this. That's not what I'm saying here. But I'm saying that many generic symptoms of the flu have been listed as COVID in order to prevent fear so that those people will wear masks more. The mortality rate for COVID in New York was 0.003%. Now, pneumonia, emphysema, other diseases have a much higher mortality rate. Yet we were forced to wear a cloth over our face in order to prevent the spreading of this. And finally, I've touched on reusing the same mask multiple times. People haven't decontaminated them. Sometimes people will throw them in the washer. But they bring what they've come into contact with outside into their house without changing on masks at every location, without wearing gloves and changing the gloves, touching the mask after they've touched other things. So now several factors have been listed as to why the mask mandate was ineffective in preventing the spread of COVID-19 in New York. The state was one of the only states in the nation and one of the only locations in the world that had a specific mandate for this. Other countries, other states remained open and ultimately prospering better than New York. Given the fact that we did not treat the world's deadliest disease with the same precautions that virologists use, there's no way that we can determine that wearing a t-shirt over your face is just as effective. Without changing the mask at every location, using a full hazmat suit, we can't look for a decrease in cases. However, the cases that were listed were determined to be false and overinflated due to government promotions.